I'm Dr. Jack Shilling. I'm an orthopedic surgeon here at the Cooper Bone and Joint Institute and the director of the Adult Reconstructive Orthopedic Program. My elective practice is predominantly arthritis and surgical treatment of arthritis of the hip and knee. So hip and knee replacement is the bulk of, is a huge part of what I do. I also deal with the complexities of failed knee replacements and failed hip replacements, infections, and things like that. I still take care of a fair amount of fractures as well as part of my duties as part of the trauma call schedule, and still very much enjoy doing that. I pride myself on taking the time and getting to know people. In a world that continually drives us to every patient's a number, we work really hard at Cooper. I work really hard personally to make certain that we spend the time and we individualize the care for whatever problem I'm taking care of. I really do believe that's what sets us apart. I believe that's what sets me apart as part of what we're trying to do here, and it's the number one reason why I'm at Cooper, is that I can still practice the way that I want to practice. I really believe that we do everything we can to treat patients like family and the way you would want your family to be treated. Healthcare is frustrating, it's scary, it's personal, and without some personal touch, without some human interaction and communication, the entire process gets more difficult. That's what I've always based my practice on, is excellence and doing the right things for the right people and taking the time to make sure that that's how it got done. That's what I stand for, and I think that's what Cooper stands for as well.